Yeah, welcome to my talk on hierarchical prediction errors. I first want to know who of you has been at Carl Friston's lecture yesterday? Who has seen that? Okay, quite a few. It's good. So for those who haven't seen it, let me just tell you that predictive coding follows from the mere fact that we exist. So I hope there's no doubt about this framework left. And this is also the framework that inspired my work. This is not working, is it? Yeah, okay. So just as a reminder, if we as scientists use Bayesian inference, then we usually think about the observable responses or the behavior that our participants show and use that behavior to infer on the things that we're actually interested in, namely their cognitive mechanisms or states or their brain mechanisms. And we do that by employing a forward model and then using the responses that we get from the agent to invert that model. And now our participants themselves face a very similar situation in that they're only confronted with the consequences of the actual states in the world that they want to know and infer on. So they could in principle follow the same strategy and have a forward mapping of how certain states in the world lead to observable inputs for them and then use these inputs to update their model. Am I too loud? Or is it? Okay, good. Okay, and these updates usually then come in the form of precision-weighted prediction errors. Now, this is still very abstract, but the good thing is we can translate it to practice, and that's what I've been trying to do. The paradigm that I've looked at is one of the classical readouts of surprise in the brain, the mismatch negativity. I'm sure you all know it, but just as a reminder, it's very simple. We just play a sequence of tones to our participants, and there is some regularity in these tones. In the simplest case, it's just a repetition of the same tone, as you see here. And sometimes there are so-called deviant events that break this regularity. And then the difference in the evoked response to these different kinds of events, measured by EEG or MEG, is then called the mismatch negativity. And it has been interpreted as an update signal in exactly that belief updating process that I've just discussed with you. Usually the amplitude of the MMN is interpreted as the precision-weighted prediction error, the size of the prediction error on that trial. Now, this paradigm has a huge clinical potential because we know that it's sensitive to various pharmacological manipulations, like NMDA receptor antagonism, and it's also reduced in certain conditions such as schizophrenia, where it's one of the most robust markers, actually, of schizophrenia. And I think the reason why this hasn't been translated as much in the clinic as it could be is that we still have these one-dimensional readouts of simple amplitude differences between average events, basically. And now what I'm trying to do is move to a different perspective where we look at every single trial and we use a computational model that tells us the amount of prediction error or surprise on each trial and see whether we can find a readout of that in the EEG signal. So I'm showing you results from two studies. The first one, that's a within subjects design, where participants either first got an infusion of either ketamine or placebo, and then came back and got a second infusion of either ketamine or placebo. That it was a simple roving paradigm, so 7 different tones, and usually then the first tone after a change is considered the deviant, and it turns into the standard tone after a few repetitions. Now, to look at that trial by trial, I've used the hierarchical Gaussian filter as a computational model for inference and learning. And this looks very complex, but just to the key thing here to note is that we propose that the participants infer on 2 quantities while they're exposed to this tone sequence. And the first one in dark green here is reflecting the regularity in that tone sequence. So in that case, it's a transition matrix for the different transition probabilities between the tones. But we also propose that they infer on the volatility, which is the speed with which these regularities change in time. And importantly, in this model, any update of a belief is proportional to precision-weighted prediction error. So these are these epsilons that I've marked here, and we're looking at the lower level prediction error, which updates the belief about the transition matrix, and the higher level prediction error, which updates the belief about volatility. Now, we use these single trial estimates of prediction error, the two epsilons, from the model, and we assume a base optimal observer, basically. So having these responses, we just enter them into a GLM on the first level for each subject, for the EEG amplitude on each trial. And then on the second level, we look at the time points and points in sensor space where the EEG signal has a significant relation and consistent across subjects with our quantities of interest. So what we find is that the lower level prediction error about the state or the regularity has an effect very early on in the trial, and these plots are not very intuitive, I think, but you can see the lower part as a scalp map, basically, from left to right and back to front, and the upper parts show you the evolution within trial time of that effect. So we see that the lower level prediction error has an effect early, while the higher level prediction error has effects later on in the trial. And this is nice because the model would also predict that the lower level is updated first, and then the higher level can follow. And interestingly, if we look at the effect of ketamine, we see that it reduces the representation of the higher level prediction error. So because this is still a normative approach, we interpret this as ketamine driving basically the learning style away from the base optimal values. Now, for the second study, I designed my own tone sequence, and this is now a binary, so we just have two tones. But importantly, I wanted to look at the effect of volatility more closely, and so this sequence follows this, so the probability of hearing the higher tone in this sequence follows the blue line. So you see that there is periods where it's rather stable, so nothing changes, and then there's periods where the probabilities switch a lot. So we have some variation of volatility now. The paradigm was used in a larger study where we recruited 2 times 81 participants. And in the first group, this is now between subjects, they received either a dopamine antagonist or an acetylcholine antagonist or a placebo. And in the second part, they received either dopamine agonist or an acetylcholine agonist or a placebo. So the modeling is now basically the same as before. It's a little bit different because we have 2 tones instead of 7, but the key thing is the same. We model the learning about the statistical regularity and the learning about the volatility. And we have the same prediction errors as before. But now we can look at more interesting effects of volatility. So this is an example of an agent with the parameter values above. And you see that this dark line on the top reflects the agent's belief about the current level of volatility, and this actually tracks the manipulation that we try to induce with the probability structure below. So our results here in the 2 parts of the study are very similar to the ones I showed you before. We see that the lower level prediction error again has an effect early, which corresponds to the classical mismatch time window where we find the average effects as well. And the higher level prediction error has effects later on. Now, again, around 230 milliseconds, but also much later, around 420. It would be very interesting to look at the drug effects now, but to do this, so I'm still not unblinded, so I don't know the drug labels yet, because I first want to find a way to actually fit this model to the EEG data itself. So I get actual individual values for the parameters of that model, because that I think would be more interesting. And luckily, we also have fMRI data using exactly the same paradigm, where we can use these activations now as source price for the EEG. Okay, so to conclude, I've shown you that very classical paradigm, the mismatch negativity, but now from a different angle, using a computational model that allows the extraction of precision-weighted prediction errors on each trial, and that these are reflected in the EEG signal, in the trial-by-trial variations of EEG amplitude in my participants. We hope that this allows for a more mechanistic interpretability of the underlying process in that paradigm. And we also hope that it will contribute to our understanding of the different alterations of that signal that we see in certain conditions such as schizophrenia or under pharmacological manipulations. So thank you for your attention.